Hi everyone, thank you for joining our webinar session today. Today we're going to talk about Imaging Koreas, which is our ultrasound program. And a very warm welcome to all of you. My name is Cherry. I'm the Student Recruitment Coordinator. And today here with me, I have Jason, and I'll pass along to Jason to introduce himself.
Thanks, Sherry. Hi everyone. How's everyone today? Hope you're keeping warm. It's starting to get cold outside, but nonetheless, I'm Jason. I'm the student recruitment officer. I work closely with Cherry. You might have seen me at some events, you might not. You might see me at future events. But essentially, we are here to promote Michener and also explain the process on how you can apply and also how you can hopefully become a student one day. And joining us is actually one of our students in the ultrasound program, is Lola, and she will share about her experience later on. But without further ado, I'm going to pass it over to Cherry and I'll let her kick off this presentation.
Thank you. I'd like to start by a land acknowledgement. The sacred land on which the Michener Institute operates has been and continues to be the traditional territory of Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, among many other unnamed and unrecognized Indigenous communities. Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibility of taking care of this land and transforming our personal and institutional relationships. We acknowledge that it is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's 7 health-related recommendations. So what exactly is ultrasound? So ultrasound is using a machine as medical imaging technique with high frequency sound waves to create images of structures inside the body, most commonly our abdominal area or even other areas that are accessible with the machine. Ultrasound is commonly used to visualize organs, monitor pregnancies, guide procedures, and also detect abnormal, say like tumors or body parts. So now I'm going to pass the time to our student guest speaker, Lola. She's going to introduce herself and talk more about her experience as a student. And thanks, Lola. Over to you.
Hi everyone, I hope you're doing well. My name is Lola. I'm a first year student at the ultrasound program. Um, my background is I have a bachelor's of science in biomedical science and psychology, so I have 2 degrees. And I decided to pursue ultrasound because anatomy is fun and working with patients is awesome. I always wanted to work with in direct patient care environment, so I thought that that would be a definitely good field for me. So how does a typical day look like? It's definitely intense program. We have a lot of lectures. We need to study hard. But it's not the worst. I could manage work with school. Usually we are online. So first term we have most of the lectures online, except we have a practice lab that is in person. Um, this schedule helps me a lot to manage work and my hobbies plus studying. Um, Mondays and Tuesdays are the busiest days because we have lectures from 9 to 4. Wednesday is a light day, and then Thursday, Friday, depending on the lab day you have, you will be in the lab. Otherwise, it's your day off. Um, yeah, definitely I can manage working part-time and I work in the hospital, so I don't have really night shifts, so it's only day shifts, but I still can manage that with my education. Um, what is your favorite part of the program and what interests me the most? I think it's the hands-on experience. We have awesome like professors, awesome courses. It's very well organized in my opinion, and we have each other to support each other because the group of students is very small. I definitely love our labs. It's fun because everything comes to life. Like we have lectures, it's all nice to see the images, but when you're in lab, you can actually experience everything, and we scanning each other. So it means that we see different body types, different organs. It's quite cool to see that everyone is so different, not only from outside, but inside too, which is awesome. In regards of the admission tips, when I was applying, it was quite hectic for me because I was trying to figure out, I was applying for 3 different programs. One was nuclear medicine, second was ultrasound, and also I was applying for CVP, which is cardiovascular perfusion. Each one had actually different requirements, but I will definitely talk about the ultrasound. I did Casper test, which is scary for everyone, and I get that. I definitely studied probably maybe like 2 months, 1 month before my test. Some people prefer to study way before that, which is fine. And I think the more time you have, the better. I used the Casper book that helped me a lot. And practice, 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 keep practicing. That's key to success always. Um, Other than Casper, to be honest with you, I don't really know what could have potentially like helped me, but I think I have healthcare experience. I volunteered in hospitals. I think that that would help a lot. And also which gives me the ability to work with patients in the past. So maybe that's something that helped me a lot. And definitely my education helped a lot. Um, the biggest tip is pay attention to the requirements because you can miss something or you can misunderstand something. I definitely made sure to annoy everyone in Michener when I was applying to make sure that I'm doing the correct thing. Ask questions, don't be shy. No questions are stupid or silly. They're all like everything is good. Don't feel free to always reach out to people and um, yeah, that's probably the key to success. As long as you keep yourself organized, you reach out, ask questions, and make sure that you review all the requirements, that will definitely bring you success.
Great. Thank you so much, Lola. It sounds like you're managing your first year really well. And now we'll have a live Q&A session in case any of our guests have questions for Lola to share more about her experience. So over to you, Jason.
Thank you. And if you do have any questions, please put them in the questions and answer chats. That way we can monitor it and just keep everything in one general area. We actually do have one question. It's from an anonymous attendee. It says, am I able to submit 2 applications, one with high school grades and one with post-secondary, or both automatically consider when applying? What what is the process? So essentially when you are applying to Michener, if you have both, I recommend you upload the transcripts to the Ontario College Application System, aka OCAS. We're going to receive both, and basically, let's say you have let's say your math in high school is better than your math in university, then we'll consider the math in high school. Um,
Yep. So
but
just to
essentially,
add on, yeah,
yes,
just to add
yes.
on to what Jason mentioned, we assess in your favor. So when you submit an application, you submit both your high school and also your undergrad transcript. We'll take the one with the higher score. Essentially, for instance, if there's a prerequisite that is required, then we take the one that scores higher from your transcript. So we assess in your favor. So we always encourage prospective students to submit both. And will assess accordingly.
And just to add to that, one more thing for the ultrasound program specifically, the 2 ways to apply to this program is to apply with a bachelor's of science from a recognized institution, or if you are already a licensed healthcare professional, so whether you're a chiropodist, a nurse, a radiological technologist, radiation therapist, or a respiratory therapist as well. So that is for the ultrasound program. Next question is another anonymous attendee. They're asking if Casper is mandatory. Yes, Casper is mandatory for majority of our programs. The only 2 programs that don't require Casper is the medical lab science and diagnostic cytology, which actually falls under our laboratory careers. So if you're looking for a career within laboratory, definitely attend our webinar that's coming up in a couple weeks. And then another one says, okay, so one application will consider both or just to confirm? Yes. So when you apply to the program, that is one application. Yes. Uh, Someone said, thank you. You're welcome. There's another question. How does ultrasound differ from other imaging modulates like MRI? Okay, so the main difference is, yes, they are very similar in terms of creating images of the human body. However, when you're doing MRI, magnetic resonance imaging, you're using magnetic uh, waves with ultrasound, you are using sound waves. And Lola, if you want to kind of talk about what the experience is like using the sound waves to create images of the human body, that'd be amazing.
Yeah, I could add on that. Well, to begin with, the ultrasound is like actually like you have like a hands-on experience. So you actually take the transducer and you scan the body of the patient, which is for us because we are studying for general ultrasound. It's going to be mainly like also abdomen that you will be studying on. Um, MRI is different because it's mainly a machine. So you pretty much like if to explain it in a simple language, you will have a patient, you will place them on the bed, and the MRI machine, you will do everything from the computer. While ultrasound is, yes, you use the machine, which produces the images, but you are actually the one who is actively scanning. So it's nothing like, you press the buttons and the machine does the work. You actually will need to find the right angle. You need to like, find the right organ, depending on the requisition. So it's just slightly different, even though you are getting images in the end. It's just different way of getting the images. I hope I'm answering the question right. But if you have any following questions, I can try to answer them.
Thank you, Lola. I do have another question in the chat. So for the ultrasound program, we can only use university transcripts, right? No high school? Correct, yes. Or if you are already say you're working as a healthcare professional, let's say you're a nurse, or maybe you are a respiratory therapist, for example, you can use your license and your credentials from say you did the respiratory program here at Michener, you can use your diploma to get into that. Those with international medical transcripts, citizen status in Canada need a West course by course evaluation? Correct, yes. So if you do have experience in your home country, if you do have the education from your home country, I do recommend getting the West course by course evaluation. As long as everything checks out, then you can definitely apply to the program, really any program here at Michener. Someone also said if your average is slightly off for a specific course required, um, sorry, I lost the question, but I think someone was asking about if the average is off, does that make a difference? It does depend, because there's also the Casper evaluation as well. And depending on the applicant pool, sometimes we look at the Casper a little bit more heavier than the overall requirements, or vice versa. We'll look at the overall requirements
Yeah.
uh, rather
Just
than
to
the
add
Casper.
on, just to add
Yes.
on that, so you must meet the minimum CGPA requirement and also the GPA requirement of the prerequisite courses. If you're mentioning like slightly off in terms of the GPA, you must meet the minimum requirement, even though you said it's slightly off. So make sure you meet the minimum requirement. If you're closer to the minimum requirement, that's totally fine. As long as your Casper score is higher. If you try to do better in your Casper score, it may balances out your CGPA and your GPA of those prerequisite courses. So I hope this answers your question, but you need to make sure you at least meet the minimum requirement.
All right. Thank you, Cherry. Someone was asking, so high school grades don't apply here? Correct, yeah. So you would need to be either have a bachelor's of science from a recognized university. Um, the other way you can also apply is say you want to eventually get into ultrasound, but you're really looking for an imaging to work within imaging, then you can apply for MRI first discipline. That one accepts high school grades. The other courses and programs that accept it are medical lab science and respiratory therapy. Someone's asking, when studying ultrasound, do you have the opportunity to specialize in a field like OB, GYN instead of just doing a general? So Lola, if you want to kind of explain what you're
Yeah.
doing so far within ultrasound.
So this term we are doing abdomen only. Next term we will be doing abdomen plus OB-GYN. So we will be exposed to the area as it's general in overall the general ultrasounds. It's like all abdomen, including the OB-GYN. We will definitely not scan each other for that part, but we will have, as they explain, it's like machines that sort of act as a patient, but it's not like alive. But yeah, you will definitely be able, like, you will not need to do anything extra. As far as they told us that just during like when you will be looking for a job, whenever you apply for like a specific area, they will definitely do the training for you in case, but you are trained for general, which means that you will be able to specialize in OB-GYN. The only one that you can't really specialized after graduating this program is going to be the cardiovascular one. You will need to take extra courses, and I think Michener provides them as far as I reviewed. But you will need to, I think, practice for 2 years in general sonography before you apply. I might be mistaken, but that's what I remember on top of my head.
Awesome. Thank you for sharing that, Lola. Um, we are just out of time. I'm gonna do one more question, and in case I didn't get to your question, I do apologize. But we do encourage you to also join our Ask Me session. That's ASKMI, and essentially that runs every Friday between 1 and 2 p.m. Eastern Standard Time, and that's where you can answer any admission-specific questions, or for example, if you have any follow-up questions, we would love for you to join that. It's a great opportunity to talk with us and even one of our admissions officers as well. So I'll do one more question. Um, let's see. Someone's asking, does ultrasound require admission statements? I'm not too sure what you mean by statements. If you're talking about transcripts, like if you have transcripts, again, from your home country, yes. So that we're gonna wrap up our webinar now. Um, I do want to thank all of you for coming out to our webinar. I do want to thank Lola for sharing her insights and Cherry for hosting this great opportunity for all of you to kind of get a little more insight on the ultrasound program here at Michener. Just in case, like I said, if you do have any other questions or maybe you want to clarify on a few things, definitely join our Ask Me session that's happening every Friday between 1 and 2 p.m. We also have our open house that's coming up on November 22nd, which is going to be at our home campus, 222 St. Patrick Street, located in downtown Toronto. We would love for you to join us. And again, if you have any other questions as well, you can emails right on screen. It's admissions@michener.ca, and we'll be happy to answer any of those questions. So for myself, for Cherry, and for Lola, we want to thank you once again. Have a wonderful evening. Take care for now, and hope to see you at Michener. Thanks, everyone. Thank you, Romel. Thank you,
Thank you,
Ganga.
guys.
Thanks, everybody.